Staying truly informed these days, it can feel like a full-time job, can't it?
Absolutely. There's just so much information flying around.
Yeah, it's tough to cut through the noise, figure out what's actually important, and why it matters.
Exactly.
And that's really why we do this deep dive, right? To give you that clear shortcut, help you get genuinely informed.
Mhm.
Today, we're digging into two health stories. They seem pretty different on the surface, but both are critically important and making headlines.
Okay, what do we got?
First, a really significant chikungunya outbreak in China. And second, a new COVID-19 variant. They're calling it Stratus, which is, well, gaining a lot of traction in the U.S.
Right. Two big ones. So
Right.
our mission here, as always, is to take the source material you've provided us, kind of break it down,
Yep.
pull out the key nuggets, and help you understand not just the what, but the so what.
Yeah.
Why it matters, what you really need to know.
Getting the clear facts, connecting those dots.
That's the goal. Helping you walk away feeling genuinely up to speed.
Okay, let's jump right into chikungunya then, because the numbers you flagged, honestly, they're quite staggering.
They really are.
Over 7,000 infections reported in southern China, right? Guangdong province.
Centered in a city called Foshan.
And this isn't just, a small cluster. The scale is something China hasn't seen since, what, almost 20 years ago when the virus first popped up there?
Exactly. It's moved beyond just occasional imported cases. This feels like a significant domestic challenge now.
So remind us, what exactly is chikungunya? I know the name is distinctive.
Yeah, it is. The virus itself was first identified way back in 1952 in Tanzania. And the key thing is how it spreads. It's mosquitoes, specifically the Aedes aegypti and Aedes albopictus types.
Wait, aren't those the same mosquitoes that carry dengue and Zika too?
Bingo. Same vectors. Which, adds another layer of complexity in areas where all these viruses circulate.
Okay, so if it's the same mosquitoes, what makes chikungunya stand out, symptom-wise?
That's a great question. So you get some of the usual suspects, initially sudden fever, feeling wiped out, muscle aches, sometimes a rash.
Mm-hmm.
But the real hallmark, the thing that defines chikungunya, is this intense joint pain. It can be absolutely debilitating.
Right, that's where the name comes from, isn't it?
Exactly. Chikungunya means that which bends up in the Kimakonde language.
Mm.
It literally describes people being stooped over in pain.
Wow. And that pain, it doesn't just go away quickly.
Unfortunately, no. The acute fever and stuff usually clear up in, say, a couple of weeks.
Yeah.
But that joint pain, it can linger for months, sometimes even years.
Years, really?
Yeah, especially for older people. Now, serious complications like fatalities are very rare, thankfully.
Okay. Yeah.
But it can be more dangerous for certain groups, infants, the elderly, people with compromised immune systems.
And just to be clear, you can't catch it directly from another person,
Right.
like a cold?
Correct. It needs the mosquito. An infected person gets bitten, mosquito picks it up, then bites someone else. That's the cycle. No direct human-to-human spread.
Got it. So this specific outbreak in China, do we know how it started? How it got so big so fast in Foshan?
Well, the health authorities there think it kicked off with an imported case. Someone traveling into Foshan probably brought it in, likely around early July.
Okay.
And from there, it seems to have spread rapidly out of the Shandong district within Foshan to other major cities nearby, like Guangzhou, Shenzhen, Dongguan.
Big urban centers.
Yeah, exactly. And we just saw the first case pop up in Hong Kong, traced back to Foshan.
Yeah.
It's definitely moving.
Which explains the travel alert from the U.S. CDC then.
Right.
Level 2 for Foshan.
Right. They're advising travelers, the standard precautions, insect repellent, long sleeves, avoid being out when mosquitoes are most active.
Peak times, yeah.
And they've specifically recommended pregnant women avoid going to that region altogether right now.
Okay, that's a strong warning. So, given this scale, what are the Chinese authorities actually doing on the ground? You mentioned it feels different this time.
They've really pulled out the stops. The approach in Guangdong is very stringent, and yes, it definitely echoes some of the tactics seen during the pandemic. People are calling them COVID-style measures.
Like what specifically?
Well, for one, they're quarantining anyone who tests positive, but not just at home in specialized mosquito-proof hospital beds.
Mosquito-proof.
Yeah, to physically prevent mosquitoes from biting patients and picking up the virus to spread it further. It's about breaking that transmission chain.
That makes sense.
And Foshan alone ramped up capacity to over 7,000 of these isolation beds, which is huge.
Wow. Especially since, as you said, there's no specific drug to treat it, right? It's just managing symptoms.
Exactly. No specific antiviral.
Yeah.
So it's about rest, fluids, pain relief, and stopping the spread.
And are they doing things out in the community too, beyond the
Oh,
hospitals?
absolutely. Big time. Public health teams are going door to door.
Doing what? Checking for?
Stagnant water. Anywhere mosquitoes could breed. Puddles, containers, plant pots, you name it.
And people have to comply.
They do. Reports suggest non-compliance can lead to fines, potentially even criminal penalties under their public health laws.
Penalties. Like,
There was one specific report about 5 households in a place called Gishang actually having their electricity cut off.
electricity cutoff. For obstructing inspections, that's pretty severe.
Definitely a very assertive approach, yeah. Shows how seriously they're taking it.
Are they using any less conventional methods too, besides inspections and fogging?
Yes, some quite interesting ones, actually. They're releasing something called elephant mosquitoes.
Elephant mosquitoes, what are those?
They're a type whose larvae actually prey on the larvae of the Aedes mosquitoes, the ones carrying chikungunya.
Ah, biological control. Using nature against nature.
Pretty much. They've also put larvae-eating fish into urban lakes and ponds, and they're using drones
Drones, for what?
to spot potential breeding sites in hard-to-reach places, like on rooftops or dense vegetation, places ground teams might miss.
Clever. So a multi-pronged attack, really.
Definitely. Inspections, quarantines, biological controls, technology, large-scale fogging, disinfection, the whole 9 yards.
Stepping back a bit, how does something like climate change factor into this? Is southern China becoming more vulnerable?
That's a really crucial point. Southern China's climate, humid, subtropical, coupled with high population density and being a major travel hub, it creates almost perfect conditions.
For mosquito-borne diseases to thrive once introduced?
Exactly. And the WHO has been warning about this for years. Rising temperatures, changing rainfall patterns, they're expanding the areas where these mosquitoes can live and breed.
Making outbreaks like this one in Foshan more likely in the future, potentially in new places too.
That's the concern, yeah. Climate change is definitely amplifying the risk.
And this isn't just a China problem, is it? Chikungunya pops up elsewhere.
Oh, absolutely. It's a global issue. We see recurring outbreaks in Brazil, Colombia, India, had a massive one back in 2006.
Right, you mentioned 1.3 million suspected cases there.
Huge numbers. Also Mexico, Nigeria, Pakistan, Thailand, the Philippines, Sri Lanka, Singapore. It's widespread.
What about the U.S.? Do we see it here?
Mostly travel-related cases. The risk of widespread local outbreaks is still considered low because while we have the mosquitoes, other factors aren't as conducive.
But the numbers have fluctuated.
They have. We saw a big jump in travel cases back in 2014, almost 3,000. It dipped, but it's creeping up again. Around 199 cases reported in 2024 and 46 recorded so far in 2025.
So people traveling, getting infected, and bringing it back.
Primarily, yes. Though, local transmission isn't impossible, just less likely on a large scale currently. But look at La Réunion, that French territory. Over 47,500 cases this year. It shows how explosive it can be.
Right. So finally on chikungunya, is there a cure? Or a vaccine people can get?
Still no specific cure once you're infected. Treatment is supportive, but there are vaccines now.
Oh.
Yes, 2 have been approved for use in the United States, IXCHIQ and Vimkanai.
But they're not being used in China for this outbreak.
Correct. Not currently available there. Which is why China's focus is so heavily on prevention, hitting the mosquitoes hard, physical barriers, the quarantines, control the vector, control the disease.
Okay, that's a really thorough look at chikungunya. Let's pivot now to the other story. COVID-19. Feels like we never stop talking about it, does it?
It keeps evolving, doesn't it?
So this new variant, Stratus, officially XFG. What's the headline news on this one? Making waves in the U.S.
Yeah, it's spreading quite rapidly. One interesting thing people are reporting early on is hoarseness as a distinctive symptom.
Hoarseness. Huh. Okay.
But importantly, the WHO's current assessment is that the overall global health risk from Stratus is low.
Low risk. That's reassuring.
And existing COVID vaccines are still expected to hold up well. They should provide good protection against getting seriously ill, even if you get a symptomatic infection.
Okay, so quick spread, maybe a unique early symptom, but not necessarily more dangerous, and vaccines still work? Is that the gist?
That seems to be the consensus for now, yes.
But its spread is noteworthy, right? How quickly did it take off?
Remarkably quickly. It was first spotted in Southeast Asia around January. In the U.S., it basically went from 0% of cases in March.
0.
Pretty much negligible, to 14% by late June. That made it the 3rd most common variant circulating here in just a few months.
Wow, that's fast growth, and globally.
It's made its way to 38 countries. By the end of June, It accounted for something like 22.7% of sequenced cases globally. So significant spread worldwide, too.
And genetically, what is Stratus? Is it related to Omicron or something totally different?
It's what scientists call a recombinant strain. Think of it like a mashup.
Okay.
It's a mix of genetic material from two earlier variants specifically,
Yeah.
F.7 and LP.8.1.2.
And LP.8.1.2, is that one we know?
Yeah, that was actually the second most common variant in the US right now. So Stratus is basically a blend of two fairly successful recent strains.
Does that mixing give it an advantage? Like, does it dodge immunity better?
That's the thinking. Some scientists believe this specific combination of mutations in XFG might help it evade our immune defenses, from past infections or vaccines a bit more effectively.
But not necessarily making people sicker.
Doesn't seem so, based on current data. More immune evasive doesn't automatically mean more severe, or even that it spreads inherently faster between people, just that it might infect people who otherwise had some immunity.
Okay. And the symptoms people do get, besides maybe that early hoarseness, are they the familiar ones?
Largely, yes. Very similar to what we saw with earlier Omicron waves.
So fever, chills, cough.
Yep. Fatigue, sore throat, maybe loss of taste or smell still, congestion, muscle aches, sometimes shortness of breath, headache, nausea, vomiting, the usual Omicron list.
Right. So the advice remains the same then. Be aware, get tested if you have symptoms.
Absolutely. Stay cautious, test if you feel unwell, follow public health guidance. The fundamentals haven't really changed. So if we kind of pull back and look at both these stories together, Chikungunya in China, Stratus in the US, different viruses, different places.
Yeah, what's the common thread here? What connects them?
I think it really hammers home the interconnectedness of it all, doesn't it? Global health is truly global. Pathogens travel, viruses evolve, an outbreak in one region can have implications, or at least offer lessons far beyond its borders.
Yeah, that's clear. And the responses are so different, too. That's fascinating.
It really is.
You've got this incredibly aggressive, almost militaristic campaign against mosquitoes in China for chikungunya, quarantines, fines, cutting off power.
Real top-down heavy intervention.
And then for Stratus in the U.S., it's more like monitoring, risk assessment, relying on vaccines, advising caution, a much lower key approach, relatively speaking. It really makes you wonder, what drives those differences? Is it the disease itself? Is it the political system? Public tolerance?
Right.
Resources?
That's a huge question, isn't it? And likely a mix of all those things. The perceived severity, the mode of transmission, vector-borne versus respiratory past experiences like SARS or COVID, the available tools like vaccines or lack thereof, and yes, absolutely, the underlying public health philosophy and governmental structure.
It highlights that ongoing struggle, doesn't it? Against diseases carried by insects, against viruses that keep changing their game plan.
Constantly. And it really underscores why understanding the science, how things spread, how interventions like mosquito control or vaccines actually work is so vital for everyone.
Well, this has been a real deep dive, moving way past the headlines on both chikungunya and Stratus. We've gotten into the science, the context, the real-world impacts.
Yeah, hopefully you listening have gained some useful insights. How global travel, climate, how we live,
Yeah.
it all shapes this infectious disease landscape we're navigating.
Definitely food for thought. And maybe a final thought to leave you with. As the world keeps getting smaller through travel and our climate keeps changing, how do we strike that balance? Between potentially aggressive public health actions needed to contain threats and respecting individual freedoms. What does the future of managing these outbreaks actually look like?